Hello, friends, and welcome to the March 1st edition of Weekly Witness, Texas Impact's weekly opportunity for mainstream Texans of faith to learn about public policy issues here in the great state of Texas and have a conversation about how you can engage in the process. My name is Scott Atnip, your host and Texas Impact's Engagement Director, and today's episode is brought to you by Methodist Healthcare Ministries of South Texas and Friendship West Baptist Church in Dallas. So a quick scheduling note off the top. We will not have a Weekly Witness episode next Monday because Texas Impact will be hosting the 4-day online Texas Interfaith Advocacy Conference Saturday through Tuesday. And I hope that many of you will register for that event and take advantage of the incredible faith and policy speakers, the sessions and opportunities to meet with your representatives. So we hope that you'll come for 4 full days, or let's be honest, we hope that you'll block out at least some time to participate in the sessions that you're able to join us for. Those who register will receive access to the materials afterwards to watch at their own convenience. You can register at texasimpact.org. I also want to note that we released not one, but 2 Weekly Witness episodes last week, one on voting rights and one on the George Floyd Act. So make sure that you subscribe to the Texas Impact YouTube channel and Weekly Witness in your favorite podcast app so you don't miss any of this exciting content. Let me just say, I loved the 2 episodes last week. I learned a lot and was challenged. And so I hope that you will join me in checking those out. But today we are talking about another important issue, one that has certainly impacted all of us over the last 12 months, and that's COVID-19 and public health. And for that, we'll be joined shortly by Ankit Sanghavi, Executive Director of the Texas Health Institute, Reverend Danielle Ayers of Friendship West Baptist Church for our Bringing It Home segment, and Josh Houston for our Legislative Update and Action Alert. But before all of that, I am honored to welcome to the conversation Mona Kafeel, Executive Director of the Texas Muslim Women's Foundation. Mona is an amazing advocate, especially when it comes to addressing women's issues, addressing issues of family violence. She is an amazing leader and friend, and I am so thankful for her to be joining us today. Mona, thank you so much. The floor is now yours for this week's Weekly Word.
Thank you, Scott, and thank you, Texas Impact, for inviting me over. And I did see both of your recordings, and yes, you're right. I did learn a lot, quite a bit. Thank you so much. So I just want to introduce Texas Muslim Women's Foundation to the community who is not aware. We are based in Plano, Texas, and we serve the victims of domestic violence by, we have 2 shelters. And we have almost 28, 29 apartments, transitional housing apartments that we serve. And we have been in the area for past 15 years. So we have all the wraparound services of, legal counseling and case management. Having said that, I think we realized long time ago that intervention there's so much you can do on the intervention side. Prevention has to be as important, and prevention, whether it is grassroots, whether it is with legislation, anyway, prevention is extremely important for us to work on. One thing that I do want to talk about is, and one example that I'm going to share, what we have been faced with COVID last year. Obviously, we have our offices shut down, but our shelters has been operational, both our shelters, since last year, and worried about if we will have COVID outbreak. However, so far we have been blessed, but that doesn't mean that we never had COVID clients. During the pandemic, we had a client who had COVID, her family had COVID, and her husband was abusive enough that the police was called. Police would not take the abuser away because he had COVID. So the family was left in the house with the abuser with COVID. The lady did not know any language, and she had no way of escaping that situation. It took us so many levels and so many layers of literally extracting that lady from that abusive situation and move her to a place where she could quarantine. So these are some of the cases that we've seen throughout last year. And keeping that in mind, right now, we are moving into 2021. We are hoping that COVID will calm down and people will be getting vaccinated. This is a month, March is a month for International Women's Day. We have International Women's Day on March 8th. It's around the corner. And I was really excited to see what they have picked up as a theme. And the topic that they picked up was choose to challenge. It's their hashtag, choose to challenge. And I think for me, that part is very important. When we talk about different faiths, whether it is Christians, Jews, Muslims, Hindus, people who are, do not follow any faith, how do we rise up to the challenge of making sure that women and the most vulnerable are taken care of? They are not in a harm's way. So I think this is an amazing topic that I would actually go and ask you, how are you choosing to challenge yourself in that? We work very closely with Texas Council on Family Violence. That's a state level coalition, and they work a lot on prevention as well as legislature work. Every cycle that they do, we have public policy committee where we bring in people, we look at some of the bills that have gone into House and state and see whether they are protecting women or protecting the survivors. Now, just to give you the number, right now, US-wide, 1 in 4 women will go through intimate partner violence. 1 in 9 men will go through intimate partner violence. So these are really hardcore numbers. In Texas, in 2019, 150 women died and 31 men were killed. So these are the numbers that we need to bring into Austin and talk about the prevention. Now, what is TCFE doing and how can you support us? We have a Purple Postcard campaign. And Purple Postcard is something very easy. You go online on TCFE website, you sign and talk to the people that we need more fundings. Domestic violence shelters right now, last year alone, there were 71,000 women seeking services. And 1 out of 2 were turned away due to lack of space. So we need, in the budget, we need full funding at any level with domestic violence. And I would urge you to seek and sign Purple Postcard for us, for the women, for anyone that you are aware of that can go through domestic violence, that is in need of shelter services and language services. So keep in mind that domestic violence does not see any culture, any faith, any race or color. So this is an issue that we all need to work together. And I think with that, I wrap up. Scott.
Yeah, thank you so much, Mona. Where do we find more information?
Yes, I will. It is Texas Council on Family Violence, Purple Postcard.
Okay. Well, thank you so much for your important work, and thank you for joining us today. Appreciate all you do. All right, next we would like to welcome to the conversation Ankit Sanghavi. Ankit currently serves as the Executive Director of the Texas Health Institute. He previously served as their Director of Community and Oral Health program. Ankit provides leadership and direction on all Texas Health Institute initiatives and develops collaborative efforts with local, state, and national partners. And we are always excited for the opportunity to partner with Ankit and THI. And we're so thankful for you being here today. Ankit, how are you doing today?
Doing good. Thanks again, Scott and Texas Impact for having me and THI join us in today's important discussion. And I would say the feeling is mutual in terms of admiration, both for the work that Texas Impact does in protecting the health and safety of all Texans and the collaboration spirit that we've always had as organizations working in the same space.
I appreciate that. And I'm sure today's topic doesn't need like a huge introduction because I'm pretty sure everyone is now familiar with the idea that we've had a global health pandemic for the last year. We talked on our staff meeting today that we're starting to see things from social media that happened a year ago. And those were some of the last things that we were able to do in person for many of us. So I don't think we need a huge description of COVID-19, but could you talk some about the impact that COVID-19 has had specifically in Texas and the role that faith communities have in responding?
Absolutely, Scott. And I'll try to be brief in the essence that I want to make sure that I highlight the key points and really utilize this opportunity to answer questions that our faith community and leaders may have. But as both Mona and you have pointed, we are almost now a year into the pandemic. So I don't think it's the best use of my time to focus on the science about the virus and why it is serious. Rather, I do want to take this opportunity, as you mentioned, to highlight that as of last week, precisely Feb 24th is the data that I'm referring to, a little over 2.2 million Texans have been infected with the virus. Approximately 42,000 Texans have died with an overall positivity rate of 13.54%, not concerningly high as I look at a national profile. That said, it's not low enough to be ignored. However, what I want to underscore, which has been the focus for us as a public health institute with a mission of advancing the health of all, that not all Texans have been proportionately impacted. Unfortunately, for example, Black African-American Texans comprise 19% of all cases in Texas. However, they only make up for 12% of the state's population. I can provide similar data points for other minority groups where their proportion of the state's population is lower than the proportion of the COVID-19 cases they have had. Another point that I personally have tried to highlight every opportunity that I've had in the last 12 months to not only share the facts of the virus and its impact on our communities, but really where solutions need to be focused on is that some of the data points or what we have been hearing through news stories, through public health and local health department updates has been the focus on health. However, it's very important to identify and address the social, emotional, mental and economic impact of the pandemic, which is not something that we have heard often about, or there is absolute clarity in terms of data. So a lot of work that needs to be done. However, given the facts that both you and Mona have shared so far, none of this is something that we have been unaware of. We just need to better recognize and try to address. So when I think about addressing, moving towards solution, and the last couple of months have really been a positive with the availability of vaccination. And last week was another rising and a win for our public health and healthcare community and the country at large with the FDA approval, emergency authorization approval of the Johnson & Johnson vaccination, that we have now 3 vaccine candidates available to address the pandemic in our community. And I think first I want to lay out that vaccines are safe and effective. That said, I do recognize and underscore that both because of past practices and the pace at which this have been delivered and deployed in our communities, there are unanswered questions that all of us have, including myself, and questions on where to find the vaccination, the process, the timeline, and next steps. However, given our role and the ability to be in the public health space, I hope I can utilize today's discussion as an opportunity to answer some of these questions. And in the process, my intent is to really engage our faith community leaders and congregations to strengthen our statewide vaccination efforts, because it's going to take all of us as a collective to work together and get over this pandemic. As I speak about what the role and importance of the faith community, I think has been the story through much of the pandemic, that you all have definitely played a very important role in addressing all aspects, including but not limited to, making sure to meet the health and emotional, mental, societal needs of our communities. And in a similar vein, as we talk about vaccination, the faith community has an equally important role to play in all aspects of vaccine distribution and access, again, including but not limited to awareness, building trust, being influencers in terms of getting the message out as more information becomes available, and ensuring and enabling access, especially in some of the most hard to reach communities. In brief, I want to, again, not provide a lot of jargon, but I want to summarize my points that vaccinations are safe and effective for the fact that they do go through rigorous process in terms of their approval A lot of that information, or most of that information, is publicly available, federally available through Center for Disease Control and Prevention. They have the COVID-19 page. And then in Texas, the Department of State Health Services, which has really been at the forefront of the state's response to the pandemic, also has a dedicated COVID-19 page with an FAQ section that should answer most of the questions that we may have, but I'll try to answer as many questions that I can in the process of today's discussion. But safe and effective for the practices and processes that have been set up. But at an individual level, they really help us prevent by reducing our ability to contract the virus. Even if I did contract the virus, if I was vaccinated, it will really work in ensuring that it doesn't lead to adverse complications. In many cases, what we have seen is resulting into death. Second is that it does build protection in terms of an immune response, that if there is an infection, the way vaccines work and science of vaccination, that it would create an immune response that would fight the virus cells, and in the process protect the health of my body, and in doing so, that of my family, that of my community. So it's also playing that larger role, that it's not just, vaccines are not just protecting us as individuals, but our families, our communities, the state, and the country. And collectively, we all are eager to get over the pandemic. So while social distancing, wearing masks are still needed and very effective in reducing the spread so far, vaccination is another tool, but an important tool, that to the point where majority of the population gets vaccinated, we can really positively and strategically think about having pandemic as part of our history and really moving forward as a community. That was the case a year ago. So I'll pause here to see, Scott, I hopefully answered your question, but happy to expand.
Yeah, well, I'm certainly excited for that time when pandemic is part of our history. But as you mentioned, vaccinations are an important part of getting us to that point. So could you walk us through that process? How does Texas determine who gets vaccinated, when, and where?
Absolutely. So it's been quite a process, but let me kind of begin with that. The state actually drafted and released a plan in October of 2019. As part an important component of the plan, the state had formed an expert vaccine allocation panel, which included both internal stakeholders and representatives from the state health department, but also external stakeholders, including those from the community, academia, and elected officials across the aisle. The EVAP is something that is a committee that meets regularly and advises the state health department, specifically the commissioner, on recommendations to further refine and improve our vaccine allocation and distribution efforts. But in a nutshell, at a high level, the way this group is organized is that they first and foremost developed a vaccine allocation guiding principles that protects our healthcare workers, protects our frontline workers, protecting our vulnerable populations, especially for those with comorbidities, mitigating health inequities, especially for factors such as demographics, poverty, insurance status, and geography, and ensuring the use of data-driven allocations as well as geographic diversity, considering Texas and its topography. And in doing so, maintaining transparency. So these guiding principles have informed actually the development of the plan itself, but the plan, and because vaccine were still being developed and waiting for FDA approvals back in October, the plan has been dependent, again at a high level, on the idea of having adequate supply of vaccination to move through the phases. So what the story has been so far for much part of the last 2.5 months is that so far we are in phase 1 with potentially limited COVID-19 vaccine doses available, where we have prioritized population in phase 1A and 1B, which includes our healthcare workers, frontline workers, and residents of senior or nursing home facilities and residents. And then second, individuals above the age of 18 years, but with chronic conditions or comorbid conditions. Again, a list of that I am happy to share on this call, or also is available both on the SHS website and the information that they have on the FAQ page. But we, so far, for a good part, we have been in phase 1. What we have gradually moved towards in the last few weeks, again, with the storms, it kind of paused the progress to some extent, but we are gradually picking up. And again, with the availability of Johnson & Johnson, and as soon as Texans receives the doses, we'll quickly move towards phase 2, which is when large number of doses are available and supply will likely meet demand. which will allow more sites to open up, but also other populations to kind of get access to vaccination. As we move further along, probably sometime spring, summer is what we can expect to move towards like having likely sufficient supply. Again, Johnson and Johnson makes things much more, or I feel rather more optimistic that we will get there sooner than later. With phase 3, what does happen is that, of course, all of the ongoing efforts of having vaccination sites, public and private providers providing vaccinations, and most population groups having access is going to be a fact. But Texas will also have the opportunity to broaden the network for other access points that may not have been available through the first 2 phases. And eventually, once it's passed, where majority of Texans have been vaccinated, we'll move to phase 4, which is sufficient supply. I've pointed out a few population or priority groups. Again, as part of our phase 1, we are in phase 1A, which is frontline healthcare workers and residents at long-term care facilities. A significant proportion of these individuals or individuals who fall into that category have been vaccinated. However, still more work to do. What we have also included is, what this work has so far also included is phase 1B, which is people 65 plus or 16 plus with a health condition that increases the risk of the COVID-19 illness. And again, as per data that is actually included in the state plan, we have a little over 10 million Texans who actually fall into the category of people over 16 plus with a health condition that has been identified or linked with severe COVID-19 illness. At the bare minimum, the number may actually be higher. So we have quite a distance to cover. So with that, and as I alluded into one of my previous comments, that I think summer is what I would say more realistically. Originally, the state was optimistic about having or achieving the idea of having most groups vaccinated or opening the vaccination access to other groups by spring. But just considering some of the lags, especially with the storm a week before last, end of spring or early summer is where we can say that we all may have a chance to get vaccinated if we don't fall into one of those categories that have been identified. Just to provide a data point, so far Texas has been allocated 7.1 million doses, and this, I think I'm sharing the numbers as of last week, Feb 24th, if I'm not getting my dates wrong. But 7.1 million doses have been allocated for Texas, includes both the vaccinations, Moderna and Pfizer. And people vaccinated with 1 dose are just over 3.1 million Texans. And those who have been fully vaccinated, that is both the doses, because both Pfizer and Moderna require 2 vaccines between 3 to 6 weeks. But the 2 doses of the vaccinations have to be taken 3 to 6 weeks out. So people, those who have, or Texans who have been fully vaccinated with both the doses of either of the vaccine candidate is approximately 1.5 million Texans. And we are a little over 28 million, if I'm not getting my math wrong, as Texans. So we definitely have a lot of distance to cover. But I think with the progress we have made in the last couple of months with Johnson & Johnson vaccine candidate now available or receiving the FDA authorization, I think I'm even more optimistic that we'll get to that end goal much sooner rather than later.
All right, late spring, early summer. All right, I'm going to mark my calendar. I know my wife is getting vaccinated this week. She's a nurse, so step one for our family. But late spring, early summer. Several people have asked when they're getting theirs, and so I think that'll give us at least an idea. So, Ankit, you and I talked last week in preparing for this that in addition to promoting vaccines, that there was going to be a significant social impact of this pandemic moving forward. So what role could congregations play in addressing the long-term impacts of the pandemic?
Thank you, Scott, for that question. And again, as I've discussed with you in the past, I already alluded into my opening comments that even for me personally, while health data is always exciting, what we have not come across as clearly that we have a shared understanding of or appreciation is the other non-health impact of the pandemic, which is economy. We have again heard something about that, but mental health, emotional health. Mona's example on the story that she shared is a wonderful example of what really the pandemic has done, that none of this data really does justice or highlights the impact. So I think when I think about that larger societal impact, not just what we have experienced in the past 12 months, but considering the changes it has brought in our daily lives, it's fair to assume that the non-health impact of the COVID-19 pandemic is going to be with us for much longer. Unfortunately, there is really not a vaccination that can address. So for me, I think personally, again, a believer in the faith that I practice, I think that is what I rely upon to ensure that I am not impacted, my family is not impacted by the emotional, mental impact of the pandemic. So I want to call that out, that our faith community has probably one of the most important roles to play. You have already again played a significant role in addressing the impact of the pandemic to date, including health, so not just non-health. So I want to recognize that you have already gone above and beyond in your role, but that's really where the value and the leadership lies in our faith community. So how we can, in terms of solutions and questions that I ask of myself, is how can faith communities come together to not only create an open space to better appreciate and understand how the pandemic has impacted each one of us as individuals, as families, but also broader communities. What support systems can we develop to have that communication or discussion on an ongoing basis? Again, this is more long-term, and some of us may not even realize that how it impacted us until it was a few years from now. So how can we create, not just think about this as a point in time, but in the longer trajectory of things, and really come together as a community of faiths to help each other and emerge stronger and resilient from this pandemic. So I think it's continuing to do what you all have, or the faith community has already done so far. But how can we really step up, considering that this is not something that none of us have experienced or expected a year ago?
Right, and this is going to be a continuing conversation that we'll have, and that the Weekly Witness Group will have over the course of the next months and maybe years. Right, Ankit, any shameless plugs or any way that we can stay up to date on your information?
I think we as a public health institute have been honored to play our part in helping address the pandemic in our state and across different communities. We as a public health institute, we are not a service provider, so very often we always find struggling to actually get the pulse on the real community impact and where information needs to be made available, but really where do solutions need to be implemented and how can we validate that they are really community-led, community-owned. So I really invite you, Scott, the broader Texas Impact team, but really the membership, to consider THI as a partner, as a resource, both in terms of accessing information, but also bringing your voice to our work, because I think that is something that I would identify as a potential weakness. Again, we are not boots on the ground. So if I can find an ally with Texas Impact and its membership as our boots on the ground, I think we will be more impactful in our work. And I just consider that as a blessing and an honor if we are able to do that.
All right, well, I really appreciate the time and information today. We all have work to do. We appreciate the information that you all provide, and look forward to ways that congregations can really get involved in putting this pandemic in the history books and helping people recover from the traumatic year that we have had. So thank you for your time and for your work.
Oh, thank you again for the opportunity, and thank you for all the good work that you do.
All right. All right. So next up, we will welcome to the conversation Reverend Danielle Ayers. If you missed the rescheduled Snow Week episode that was originally scheduled for 2 weeks ago, we released it on Friday. During that episode, we introduced a new segment entitled Bringing It Home, featuring Reverend Danielle Ayers, Minister of Justice with Friendship West in Dallas, who will talk to us about once a month about how congregations can bring home the message from Weekly Witness to your local congregation. And so in the last episode, she followed her senior pastor, Dr. Frederick Douglass Haynes III, and Representative Retta Bowers. She was joined by Reverend Edwin Robinson to talk about racial justice. So I hope everybody will go check out that conversation. This week, Danielle's here to talk with us about COVID-19 and public health. So Pastor Ayers, take it away.
So good afternoon to everyone, and to you, Scott. And again, thank you for the opportunity to co-sponsor and be a part of this both not only significant work, but very important work in the time that we are in. And so I think what I want to talk about today are some of the ways that congregations, and I appreciate the previous conversation as well, because I think it's so important for us to know what we can do as faith communities around the state of Texas. And of course, this is all based on our social location, because everybody won't have the exact same challenges, but there are some ways I think that we all can, as faith communities, do our part to be a part of this global pandemic, and certainly increasing what is a public health crisis for many of us and many in our particular communities. And so I think some of the things we have done, I'll back up and then kind of come to the current, because it kind of shows the continuum of what we can do to be engaged and use whatever resources we have to bring directly to the communities that we serve, not just our congregations, but the communities that surround the congregation, and even the city, right? It could also be citywide impact. So when the pandemic first hit, particularly in Dallas County, we quickly found that there was a disparity in testing sites and the ability for people to be tested for COVID. And so what we simply did was just had to open our parking lot up to a partner who wanted to bring testing to the southern side of Dallas, right? So that was one of the ways in which it didn't cost us a lot of resources to do that. It was just making our property available for the community to be able to come out and to be tested. So that was a significant impact. Otherwise, other people didn't have a way to get to testing because it was so far away up north. And then some were able to walk to the testing site because we were centrally located within the community. And since then, since we moved from really the testing phase now to how do we make sure people are able to, one, get registered, and two, be able to get access to the vaccine. So a new problem we have found that has emerged in Dallas County, in the city of Dallas as well, is that people are not registering. They're not able to be registered. And for us, that's a challenge in our communities because of two things. One, many of our elderly people here do not have access to technology or know how to use the technology. And then there's some people who just do not know what needs to be done and how the process works. So then I think what communities can do, and what we have done, and what any faith community can do, is really be strategic about allocating either volunteers or your staff to be registration sites, right? To be a place where people can come and drive up and do registrations, make your laptops, your iPads, your phones, all that available so people can drive up and you can enter their registrations, or do a phone banking, right? Do a phone bank. You start with your own congregation, phone bank, see who needs to be registered and on the list to receive the vaccine, and or just have your parking lot open and have people drive up and have volunteers and staff, register people on the spot. So I think right now we're challenged right now with getting enough people registered in order to get the vaccines. The way it was last week, we were going to run out of people. Then we had more vaccines than we had people registered. And so we know in our community, there's a deficit. And so we're making a really big push to really, register people at apartment complexes, places where we know we have a high concentration of seniors living. So I think it's important for where you are, your house of worship, where you are, what is the greater need? Where do you see where you can plug in and where you can allocate your resources to be a part of making sure folks can get access to the vaccine, but more importantly, where they can register. And I think may want to also consider, because this is where we get some emails and phone calls, which are, they're legitimate concerns. People are also asking, what are the risks of the vaccine? Does it matter which one you get? Like questions people have about the vaccine that are legitimate and should be acknowledged and answered. So it may also be a good idea for congregations to either pull on information that's already out there and create like a Q&A fact sheet that you can disseminate throughout your community and your congregation. So people are clear and have their questions answered. They can feel at ease to even register to receive the vaccine. Because we also have some people who are pushing back because they're just not clear and they're not aware and they're just not sure what the vaccine means for them. So I think those are the two things that we can do immediately where we are. But that also requires us understanding in your own social location, what are the challenges that you may have? Because everybody's challenge won't be the same. Our challenge may not be someone else's challenge in the state, but I certainly think that's how we can be of help and assistance. And if your immediate reach in your, what you would consider to be your parish, right, that you serve, if they're fine, well, is there another location in your city that may be struggling that you can partner with another faith community who needs resources and may need to register? Can you then partner with other congregations to help them out if you don't have that problem, at your church? So I think that's what I would emphasize in this week's Weekly Witness is take the information, put it in a good like fact sheet that people can understand in plain language, so people are clear about what the process is, where we're going and where we're trying to go with the vaccine, and how the importance of the vaccination and how they can get registered, and the health concerns and questions they have about that. How can you clearly communicate that to them in a way they can understand it and feel comfortable?
And I know I've seen Friendship West, and I've seen other congregations like make that announcement during services, right? Like, we're gonna need y'all to get vaccinated, and if you need help, let us know, right? It's important. Cool. All right. Well, Reverend Ayers, thank you so much for your time today. I know you've got a lot going on, so I appreciate the time, and have a great rest of your week. Thanks. All right. Next, we will welcome to the conversation our advocacy director, Josh Houston, who's going to talk us through our legislative update and action alert for the week. And Josh, I just know based on the text exchanges that we had in the office group text last week, that you were certainly geeking out, if that's fair to say on a podcast, on all of the talk of the electric market. So based on the conversations the state will continue to have in response to the winter storms, what do we need to know?
Well, it's important to remember how it works. And I think everyone can be excused for not knowing how it works. We all wanted the lights to come on, and then when it didn't, they didn't. Maybe more importantly, the heat to come on, and when it didn't, we all begin to question. So let's back up and do a little 101. There are three big functions of an electric utility system. One, the generators. You have to generate the power. You have to, two, transmit the power from the generation station to the customer. And then three, you have to figure out how to bill the customer and do the customer service for the customer on that end of it. In Texas, there are three different types of electric utilities. There are municipally owned utilities, which are what they sound like. Your city owns your utility. A cooperative, an electric cooperative, often in the rural areas, but increasingly in suburban areas. This is where each member owns or elects representation and thus controls the company. And then in most of the state, you have what's called the investor-owned utility market. So with municipalities and with co-ops, they have what you call a vertically integrated system. So let me make that in plain English. It means that the municipalities and the co-ops generate, they transmit, and they bill you. They do all three of those functions in-house. This is the traditional way a utility works. In the investor-owned utility market, there's actually three different companies responsible for your lights coming on. There is the generation facility, which is minimally regulated in the state. They pretty much produce power and sell it. You have the transmission distribution utility that is responsible for all the lines from the generator to your meter. And then you have what are called retail electric providers, which not only bill you and not only do customer service, but they buy and sell to you as a middleman the power that the generators produce. So they buy it wholesale from the generator and then turn around and sell it to you. So they basically made a mini stock market, if you will, out of the public utility system. Why does this matter? Because it has to do with who's accountable and who's responsible. If it's a publicly owned municipal utility, you elect the city council that governs it. If it's an electric cooperative, you get sent a ballot in the mail and you elect representation to represent you on the board of that governing board of that utility. But we would like to have you believe, I say we as in Texas would like to have you believe, that there is really very little accountability for the investor-owned utility market. It's all private and we've privatized it and we're not responsible. That's not true. The Public Utility Commission is the regulator. But even before you get there, the buck ultimately stops with the Texas legislature. They created this stock market system with Senate Bill 7 in 1999, and they can completely make a new one. And that is, I think, where the conversation is going. And we're not sure how far it's going, whether or not there's going to be minor tweaks and we claim it's fixed, or whether or not we're going to have an overhaul.
So one of the things that we talked about going into last week's hearings was that this was kind of the first significant hearings that a state committee would be having this session. We're still in the gearing up process, right? So what did you learn from those hearings and from that experience?
Yeah, quite a bit. I mean, the media had really good coverage. And then when you get into a hearing room, you really get into the nitty-gritty details. So some top line stuff. Half of the available capacity, generation capacity in the state went offline and was offline for more than 3 days. And we came minutes away from a total grid collapse. And I want to talk more about this in a second, but let's kind of back up and say the agencies came to testify as you would expect in a hearing of this nature. The Public Utility Commission and ERCOT. ERCOT falls under the regulation of the Public Utility Commission. Frankly, and this, I mean, if you've read the news, that's not Josh's words alone. Neither inspired confidence. The industry was more interesting. The various industries, the generation, the transmission, distribution, the gas, on the drilling side, the oil and gas industry, they were all much more interesting. And as you might expect, throughout the day, there were accusations and finger pointing. The generators, for instance, said they couldn't get gas. And then the gas guys turned around and said they couldn't get electricity to pump the gas. But both are completely true. Both are true. And it actually kind of leads to the cascade of problems that almost really should really frighten us. But let's back up. Whenever you see this, it's kind of like the old law school criminal law problem of if it takes 50 milligrams of arsenic to kill somebody and 10 people come along and each put in 5 milligrams, who's guilty? Well, all of them, right? I mean, there's all a systemic failure. So in this finger pointing of it was them, well, wait a minute. Yes, I can say, Scott, you put 5 milligrams in, and oh, Josh, you put 5 milligrams in. Yeah, we were both contributing to that. So, let's kind of look at how the state has an underground grid of sorts, which are the pipelines. The pipelines interconnect the wellhead to the electric generator. So rather than store gas on site, which might have prevented some of that, the relationship, the interconnectedness between the oil and gas industry and the electric generation industry, the gas industry pretty much puts a pump and just pumps it right out of the ground and pipes it to the purchaser. And in this case, the purchaser was the electric generator. And so when one failed, the other failed, and it became this cascade of failures. Why is this so critical, and why am I telling you this? We came within 4 minutes of a total grid collapse, which came out in the hearing. And if the grid had collapsed, more than 90% of the state, Texans in the state, would have been without power for more than a month. It would have taken them over a month to do what's called a black start and to start bringing the grid back online. And it wouldn't have just been your heat, and it wouldn't have just been your water. It would have been your cell phone service for more than a month. If you think about Hurricane Katrina and how FEMA botched a city the size of New Orleans, trying to feed people in the city of New Orleans, imagine a state as geographically large as Texas with 30 million people, the level of disaster response that would have been required, 30 million people without refrigeration for a month. And how do you even gas up your car and leave the state in a state this size when it takes a tank of gas just to reach the state line from a place like Austin, and the pumps don't work because the pumps don't have electricity? It would have been a humanitarian nightmare if that had happened.
Well, that's fun to think about. All right, so we're really a week, Josh, away from like significant legislation starting to move and be considered. But what's happening this week?
Well, yeah, let me wrap up before I go to this week. This was the first time I can remember a 2-day hearing. They've happened before, like in the 70s. I've seen in the record the 3-day hearings that used to happen back then. I've never seen one in the 15 years I've been doing this. It's also not the first time, but the first time in a really long time where the outcome isn't completely predictable. And that's quite remarkable because we've lobbied utility and electric stuff specifically as an organization earlier this decade on energy efficiency work and some renewable work. It's a very industry-driven policy area. There's a political science term called regulatory capture, and it's when the regulated pretty much control the regulator. You can debate about when you've hit that threshold. It's a fuzzy line, but it certainly can look that way to anybody who's ever tried to affect change in this policy area. So I say all this to say you have a opportunity, a massive opportunity that comes around, 20 years, once every 20 years at best, to shape a big, massive policy area. And we'll talk more about that with what you should say in a little bit, but let's talk about next week, right, Scott?
Yeah. So what's happening this week in the Capitol?
Okay. So this week they are entering kind of more of a normal, well, not normal. I just said they're entering the season, if you will, of the legislative cycle where committee hearings are about to start. They have scheduled and are having this week what are called organizational meetings. In other words, no legislation is going to be held, but it is the first time, especially on the House side, the first time that the committee has met together. And what usually happens is there's a lot of invited testimony. The invited people are the agencies of which the committee has jurisdiction over, and often regulated industries as well, stakeholders of a regulated nature. Are invited in to kind of give big overviews of the issues that committee is going to be facing for the next period of time that we're entering for the legislative life cycle. So we're going to have a lot of those hearings start up, and then we can predict probably, not certain, nothing's ever certain in the legislature, but as certain as you can say in the legislature, that we'll be starting to have bills in these committees in 2 weeks. So not this week, but the next week after that. And usually they start small. Usually they have a handful of bills, and it's kind of a warm-up week for the clerks who, have a lot of work to do. And it's kind of usually it's worked out bills, usually bills that have been worked out and aren't highly controversial. And that's usually the week that we have after the organizational week, but we'll see.
So the next time you and I are together on Weekly Witness, hopefully we'll be able to preview some hearings on bills.
Yeah. Exactly.
So action alert for this week. What are we asking people to do?
Still continue to call. So you have seriously a once in a 20-year opportunity, maybe longer than that, frankly, just because of the size and scope of the catastrophe. To influence a major policy area. I can't remember a time quite similar to this in state government. And I want to prep you for what you're probably in for. From my experience working in this policy area, they're going to want to tell you, you just don't understand, it's too complicated. You can't possibly church boy, because I get this. I'm an attorney. I've been lobbying for 15 years, or at least in and around state government for 15 years, working on staff for a former House member as well. They act this way towards me, so they're certainly going to do it to you. So get ready for this, that you can't possibly understand the energy-only market. You can't understand the capacity market or peak demand or the BIP versus 4CP methods of calculating cost of service in a rate case. Stop. No. That's them trying to make it complicated so that they're preventing your access to it. The metrics are really simple. Is the utility clean, affordable, and I stress and, reliable? And why am I stressing the word and? Because there are people like me who get paid a lot more than me to message this to you. And some of them will try to pit these three things you care about. Is the source of generation clean as possible, and as affordable as possible, and as reliable as possible? And they're going to pit these things against each other. They're going to say, if you want reliability, then you shouldn't have wind because it's variable. If you want affordability, you can't possibly afford a capacity market because you're going to suck it to poor people. No, this is spin. They're making it, if you hear somebody making it an either or, there's an agenda. It is all three. It is reliability, affordability, and sustainability. It is all three. And the best way to achieve that is to put the public back in public utility. 11 states have a publicly elected public utility commission. A public utility commission that's elected keeps the voters in direct control over the regulator. When you have a state where the governor appoints, a governor is responsible for many things: education, healthcare, the business climate. Think about the portfolio of everything the legislature does. The governor has a say over. So when you go to the ballot box, it's really hard to hold the governor accountable for a thing specific to utilities when there's so many other issues in play. And what this does is it allows a regulatory capture to occur, where the ratepayer, don't have a direct line of accountability to the ballot box, to the people responsible for regulating a critical public utility.
All right, so that action alert can be found at texasimpact.org on the Action Center page. We're going to be updating those every Monday afternoon after Weekly Witness. And so check that page and make sure you're making telephone calls on that action alert every Monday afternoon or Tuesday using the toll-free numbers that are provided in the directory at the bottom of that Action Center page, so we can track the number of calls that go in. Josh, anything you'd like to leave us with today?
Just don't let them pit those three things against each other. If it's not reliable and the power goes off, people die. If it's not affordable, my goodness, they could absolutely design electric rates progressively, just like tax structures. So low-income people aren't the ones paying for it, and they can absolutely do it in a sustainable way. Don't let them pit, gas versus wind versus solar. Don't let them only focus on supply side. There's demand side things that can be done too. Energy efficiency, a thing called demand response, which is paying big customers to turn off the lights, for them to have their power shut off basically in an emergency. And it's time to get real about climate. One of the things that came out of the hearing was the electric generator NRG said without fear to the committee, yes, we believe in climate change and we are taking steps to account for it. You're already seeing the insurance actuaries and the military make strategic preparations for climate change. It is really time the state of Texas, looks at the rising sea levels in Galveston Bay, counts the number of 100-degree days, counts the number of 100 and 500-year floods that have happened just in the last decade, and said, okay, we've got to have our agencies, not just electric generation, obviously that's a huge one, but disaster response, and every agency that's having to respond to this crisis have a plan for what to do when this happens, something like this happens again.
And B and I talked about this in the episode that got released on Friday. Hundreds of people just that we know were making telephone calls to legislators, and I'm sure that means that thousands and thousands made telephone calls. The legislature seemed to respond to the public pressure they're getting, right?
Oh, they absolutely are. I have never seen, if you're an elected official, it's sort of like being a lawyer. You don't really want to ask a question you don't know the answer to. You don't really want to have a hearing until you know generally where you're going to go policy-wise. And I don't mean it's a fait accompli always. It's certainly not always, but a general idea. We're heading in a northerly direction, like ballpark, between these foul lines, we're headed that way. It was really wide ranging. Really knowing that they had to get to the bottom of it. And I just hope that they maintain that level of focus. I fear that when it becomes hard and they have, because don't get me wrong, there are a number of various interest groups that pay big rates and big taxes that are affected. They have lobbyists, they have teams of lawyers, teams of lobbyists, and bukus of campaign contribution money. and they are very invested in the way things are. And they're not all going to agree. I don't mean to say they're all corrupt. They all have disagreements. And when they all start fighting, it's going to be really challenging for lawmakers to find a path forward with that many powerful interest groups fighting with each other. And it is going to be critically important for you to push them on and push them on in a productive way with those three principles in mind: sustainability, affordability, reliability, because they're going to have to lead, and it's going to get very hard to lead with that much noise. And it's going to be very, very tempting for when the road gets tough for politicians to say, okay, well, let's distract them with something like bathrooms. Let's distract them with something like some social issue that is going to be used to distract from this. So no, they're absolutely paying attention now, and what you do now sows the seed for what will grow in the months to come, because their time frame is very short. It is March 1. They have 3 months till Sunny Day to do a thing that took them pretty much the entire 1990s to debate. Which was the Senate Bill 7, culminated in Senate Bill 7 in 1999. But they were talking about how to structure the market. Enron was highly involved in those lobby efforts for, a good part of the 1990s. And they've got to do all that in 3 months. That is it is a huge challenge, and it is up to us, the voters, to keep them focused.
I think we should all find some encouragement in that this isn't an issue that has hardened positions. And so the telephone calls are really important this time. And this is one that I think we can get our friends and neighbors to make telephone calls on as well, because it's not necessarily ideological, right? Like people.
And I'll tell you, I mean, I don't mean to be cynical about, I'm not cynical at all. If it sounded cynical, I want to end with at least close, or at least stay this. Big money only prevails when people aren't paying attention. At the end of the day, democracy prevails over capitalism. Democracy allows for capitalism because capitalism is a public good. The public utility is a public good. But at the end of the day, it's the democracy that is in charge. And that means you, the voter. So when the voter is paying attention, the voter will prevail, because we don't count the number of campaign contributions. We count the number of votes.
All right, friends. Well, we'll leave it there. I'm sure we'll chat about this more later in the legislative session. But as we prepare to close out today, I want to remind you of a couple of Texas Impact opportunities this legislative session. First, a reminder that beginning Saturday, we have Texas Interfaith Advocacy Days. That's Saturday through Tuesday. A couple hours of sessions per day with some really great speakers. And so I'd encourage you to check out that schedule and register at texasimpact.org. Next, I'd love for you to consider joining Texas Impact Rapid Response Team so you can receive updates, email and text updates when it's important for you to make telephone calls, and especially when your legislator really needs to hear from you specifically. Or join the legislative engagement group so you can be paired up with other advocates in your legislative district to hold each other accountable for building relationships with your legislators. And remember, if you appreciate Texas Impact and the Weekly Witness community, please make sure that you and your congregation are members of Texas Impact. Our work is supported by members like you. So you can go to texasimpact.org/join. Friends, the legislature is in session, and we need you and your congregation active and engaged. Subscribe to the podcast, to leave a rating and review, join the team, invite a friend, and let's get to work.